Hello, I'm David from Active Middle-Aged Life. Thank you for joining us again today.
Hello, I'm Emily. Last time we learned about strength training, rest, and nutrition management, and it was really systematic, wasn't it?
That's right, I learned perfectly about the remaining two elements of the 3+2+2 system. But Emily, I have one concern.
What are you concerned about?
I don't know what to do if I get injured while exercising. What should I do if my knee or back hurts?
That's a really important question. Today, I'll tell you exactly about that part. Injury prevention and management for middle-aged runners. Complete guide to knee, ankle, and back pain.
I'm really excited. Then let's start with the most common injuries for middle-aged runners.
Yes, the most common injuries for middle-aged runners are knee pain, ankle sprains, and back pain. These three account for 80% of all running injuries.
Is knee pain the most common?
That's right. 60% of middle-aged runners experience knee pain. The main causes are knee joint wear, quadriceps weakness, and poor running posture.
Is there a way to prevent knee pain?
Yes, there are several ways to prevent knee pain. First, maintain proper running posture. Land with your foot on the center line of your body, and make sure your knee points in the same direction as your toes. Be especially careful not to let your knee bend inward or outward. Second, strengthen your quadriceps. Squats and lunges are effective. Third, do sufficient warm-up. About 10 minutes of light jogging followed by dynamic stretching will help your knee joints move smoothly. Fourth, choose proper running shoes. Wear shoes with good shock absorption to avoid putting strain on your knees.
How do you prevent ankle sprains?
Ankle sprains are mainly caused by ankle muscle weakness and decreased balance. As you reach middle age, the muscles around your ankles weaken and your balance ability decreases, making sprains more frequent. There are several prevention methods. First, do ankle muscle strengthening exercises. Ankle alphabet drawing and toe gripping exercises are effective. Second, do balance exercises. Standing on one foot with eyes closed. These exercises help. Third, do ankle stretching before exercise. Rotate your ankle clockwise and counterclockwise 10 times each to make your ankles more flexible. Fourth, develop habits to protect your ankles. Be careful when going downstairs or walking on unstable surfaces.
What about back pain?
Back pain is a very common problem for middle-aged runners. The main causes are core muscle weakness, poor running posture, and prolonged sitting lifestyle. As you reach middle age, your abdominal and back muscles weaken, making it difficult to properly support your spine. There are several prevention methods. First, strengthen your core muscles. Planks, dead bugs, and bird dogs are most effective. Second, maintain proper running posture. Don't bend your back too far forward. Run with your chest up. Third, develop habits to protect your back. When lifting heavy objects, bend your knees and lift. Fourth, do regular stretching. Especially cat-cow stretches and spinal rotation stretches are helpful.
Then what should you do when you get injured?
When injured, immediately apply RICE treatment. Rest, ice, compression, and elevation. This treatment for 48 to 72 hours will help most injuries improve.
How do you specifically do RICE treatment?
RICE treatment is the most important first aid for injuries. Let me explain each step in detail. Rest means stopping exercise immediately. Don't move the injured area and apply a splint if necessary. Ice means applying ice for 15 to 20 minutes, then repeating every 1 to 2 hours. Don't apply ice directly to the skin, wrap it in a towel. Compression means wrapping the injured area with a compression bandage. Be careful not to wrap too tightly. Elevation means raising the injured area above heart level. For leg injuries, prop it up with a pillow. This treatment for 48 to 72 hours will help most injuries improve.
When should you see a doctor?
If pain continues after 2 to 3 days, or if there's severe swelling, or if the joint doesn't move, consult a doctor. Especially if you hear a pop sound in your knee, or if your ankle swells severely, go to the hospital immediately.
When can you start exercising again after an injury?
Start when the pain is completely gone and you can move the injured area normally. It usually takes 1 to 2 weeks. Start with light exercise and gradually increase intensity.
Is there a daily checklist for injury prevention?
Yes, check these 6 things daily. First, check in the morning if your joints are stiff. Especially check if your knees, ankles, or back hurt. Second, do sufficient warm-up before exercise. At least 10 minutes of light jogging and dynamic stretching. Third, stop immediately if pain occurs during exercise. The thought of pushing through pain is dangerous. Fourth, do sufficient cool down after exercise. Walk slowly for about 15 minutes and do static stretching. Fifth, get enough sleep. 7 to 8 hours of sleep is essential for muscle recovery. Sixth, do at least 1 injury prevention exercise daily. Do at least 1 of plank, squats, or ankle alphabet drawing. These 3 exercises alone can reduce injury risk by 70%. Additionally, lunges, ankle stretching, and balance exercises are also helpful.
Running shoe selection must be important too, right?
Of course, middle-aged runners should choose shoes with good shock absorption and stability. Choose shoes that match your arch type and replace them every 500 to 800 kilometers. And it's better to buy shoes in the evening because that's when your feet are most swollen after a day of activity. There are several things to consider when choosing running shoes. First, choose the right size for your feet. Too small will pinch your toes, too big will make your feet slip. Second, choose shoes with shock absorption features, especially to avoid putting strain on your knees. Third, choose shoes with good stability. Shoes that support your ankles are good. Fourth, choose breathable materials. Moist feet increase injury risk.
Should you also consider the exercise environment?
Yes, if possible, exercise on soft surfaces. Grass or running tracks are better than asphalt. And check your route beforehand to avoid dangerous sections. At night, always wear reflective gear.
How should you do stretching?
Do dynamic stretching before exercise and static stretching after exercise. Dynamic stretching is moving stretches like knee raises, leg swings, and arm circles. Static stretching is holding stretches for 30 seconds.
It's really systematic. How can you apply all this to daily life?
Great question. Do 10 minutes of injury prevention exercise every morning. 1 minute plank, 10 squats, 1 minute ankle alphabet drawing, 5-minute stretching is enough. This way you can start your day healthily. Let me tell you more about daily application methods. First, include it in your morning routine. Doing injury prevention exercises right after brushing your teeth becomes a habit. Second, make a pre- and post-exercise checklist. Record warm-up, cool down, pain checks, etc. Third, do it with family. Encourage each other and spot injury signs early. Fourth, use exercise apps. Record your progress and set goals. Fifth, make a weekly plan. Monday, knee strengthening, Tuesday, ankle strengthening, Wednesday, back strengthening, like this.
How should you approach it mentally when injured?
Injuries can happen to anyone. The important thing is not to rush. Wait until you're completely recovered, and during that time, do other exercises. Low-impact exercises like swimming or cycling are good.
Is there a way to get help from family or friends?
Yes, exercising with a partner helps you encourage each other and spot injury signs early. And if you tell your family about your exercise plan, you can prepare for emergencies. Using exercise apps to record your progress is also good.
Today's content was really practical. Middle-aged runners can apply it right away.
That's right. Injury prevention is the foundation of exercise. With the right knowledge and consistent practice, middle-aged people can run safely and happily. The important thing is not to overdo it. Start with small steps from today for healthy running.
What topic will we meet with next time?
Next time, we'll learn about mindset and motivation for middle-aged runners. I'll prepare mental preparation and motivation maintenance methods for continuous exercise.
That's a really important topic. Then see you next time.
Yes, we'll be with active middle-aged runners again next time.